So, hello everyone, welcome back to Anima Anatomia. Today we will discuss the joints of the lower limb. So, what should you know about any joint? First of all, you need to know the types of the joint. Then you need to know the articular surface. Then you need to know the accessory ligaments. Then you need to know the joints inside the structures inside the joint. Then movements of the joint and stability of the joint. Mainly, we will talk about the stability of the hip joint. Next one, we will start with the types of the joint. So, first joint we have hip joint, that is a type of ball and socket joint. Then we have the knee joint, it is a type of condylar joint. Then we have superior tibiofibular joint, that is a plain joint. Then we have inferior tibiofibular joint, that is a fibrous joint. Then we have ankle joint, which is a hinge joint. Then we have a talocalcaneo-navicular joint, that is a type of ball and socket. Then you need to know all are synovial joint. All the joints of the lower limb are synovial except the inferior tibiofibular joint, which is a fibrous joint. Then we have articular surfaces. First one we have the hip joint. So articular surface for the hip joint, we have the acetabulum of the hip bone, and second one we have the head of the femur. You can see this is the head of femur, and this is the acetabulum and the acetabulum act as a socket, and head of the femur act as the ball. In this joint, the ball fits into the socket of the acetabulum. Next one, we have the knee joint. We have two femoral condyles, we have two tibial condyles, we have patella, and you can see this one is your femoral condyles, and this region is your tibial condyles, and this region is your patella or kneecap. That are the articulating surface for the knee joint. Next one, we have the ankle joint. Ankle joint, we have the articulating surface, lower end of the tibia, lower end of the fibula, and the talus. You can see this is your ankle joint. This is your ankle joint that is between the tibia, fibula, and the talus. Next one, we have the subtalar joint. Subtalar joint, it is a joint that is between the talus and the calcaneus bone. That this subtalar joint is just below the ankle joint. You can see this is your talus bone, this is your calcaneus bone, and between these two bones we have the joint. This joint, it is called as subtalar joint. Next one, we have the talocalcaneo-navicular joint. This joint is present between the talus, calcaneus, navicular, and the ligament associated with this joint is the spring ligament that accommodates the talocalcaneo-navicular joint. This joint, you can see this is your navicular bone, this is your talus bone, this is your calcaneus bone, and this is your spring ligament. You can see this is your spring ligament, and between these we have this joint that is called talocalcaneo-navicular joint. So let's start with the hip joint. So it is a type of synovial ball and socket joint. Next one, we have the articular surface. We have the acetabulum of the hip bone and head of the femur. You can see this one, it is the acetabulum, and this is the head of the femur. This head of the femur fits into the socket of the acetabulum, and then we have the stability. Stability, like the shoulder joint, hip joint is also the most stable joint due to the some features, like we have the shape of the articular surface. First one, we have the shape of the articular surface. So shape of the articular surface, we have the deep acetabulum and a smaller head, so the head fits into the acetabulum. Next one, we have the strong ligaments. Then we have the surrounding muscles. Then we have the atmospheric pressures. These are the features that helps in the stabilization of the hip joint. Next one, we will discuss the structures inside the hip joint. So we have the two main structures inside the hip joint. We have the acetabular labrum, and second one we have the ligaments of the head of the femur. You can see this acetabular labrum, this ring-like structure. It is called as the acetabular labrum, and this one ligament, you can see this ligament, it is the ligament of head of the femur. This acetabular labrum, it depends the concavity of the acetabulum to prevent the hip dislocation. Next one, ligaments of the head of the femur, it contains the acetabular artery from the obturator artery which supply the head of the femur. Next one, we will discuss the three important accessory ligament associated with the hip joint. First one ligament, we have the iliofemoral ligament. Then we have the pivofemoral ligament, and last one we have the ischiofemoral ligament. So this ligament is present between the hip bone and the femur. That's why we named ilio, pivo, and ischiofemoral ligament. You can see this ligament, this one ligament, it is your iliofemoral ligament. And this one ligament, you can see this ligament, it is your pivofemoral. And this one ligament, you can see this is your ischiofemoral. So what is the function of this ligament? This ligament, iliofemoral ligament, it prevents the hyperextension. Then we have the pivofemoral ligament that prevents the hyperabduction. Then we have the ischiofemoral, this one ligament, it helps to prevent the excessive medial rotation. Now we will talk about the movement of the hip joint. Movement of hip joint, it is a multi-axial joint. So there are many movements occurring in the hip joint, like we have the flexion, we have the extension, we have the adduction, we have the abduction, we have the rotation. So you can, and for the hip joint movement, there are many muscles that accommodate the movement of the hip joint, such as we have for flexion, we have the main flexor muscle, psoas major muscles, and iliacus muscle. Then we have the extension. For extension, we have the extensor muscle like gluteus maximus. For adduction, we have the adductors muscle like adductor longus, adductor brevis, adductor magnus. For abduction, we have the abductors muscles like gluteus medius, gluteus minimus, tensor fascia lata. So rotation, we have lateral rotation as well as medial rotation. For lateral rotation, we have the muscles that accommodate the lateral rotation is the piriformis muscle, quadratus femoris, obturator internus, and two gemelli. Then we have the adductors. Next one, we have the medial rotation. This rotation is accommodated by gluteus medius, gluteus minimus, and tensor fascia lata. Next one, we have the knee joint. It is a type of synovial condylar joint. Articular surface, we have the two femoral condyles, two tibial condyles, and the patella. So we have two accessory ligaments associated with the knee joint, that is the tibial collateral ligament and the fibular collateral ligament. This tibial collateral ligament, it is present on the medial aspect, and your fibular collateral ligament, it is present on the lateral side. So the extension of the tibial collateral ligament, it extends from the medial epicondyle of the femur to the medial condyle of the tibia. Next one, we have the fibular collateral ligament. This ligament extends from the lateral epicondyle of the femur to the styloid process of the fibula. Next one, we have the structures inside the knee joint. So we have the two important structures present inside the knee joint, two cruciate ligament and two menisci. two cruciate ligament and two menisci. So we have the anterior cruciate ligament ACL and PCL, posterior cruciate ligament. So anterior cruciate ligament, what is the main function of the anterior cruciate ligament? It prevents hyperextension and displacement of the tibia. This anterior cruciate ligament. Next one, we have the posterior cruciate ligament that prevents the hyperflexion and posterior displacement of the tibia. Then we have the two menisci. We have the medial menisci and we have the lateral menisci. So this menisci adapt the femoral condyles to the tibial condyles. Femoral condyles to the tibial condyles, and this medial menisci is more liable to the injury. Medial menisci is more liable to the injury. You can see this is your femoral. This is the femoral condyles. This is your tibial condyles, and this is your femoral condyles. This is your tibial condyles. This is your patella or kneecap that forms the knee joint. Then you can see this one structure. You can see we have two accessory ligaments, and we have two menisci. So you can see this one structure. This is your anterior cruciate ligament, and this is your posterior cruciate ligament, and this structure you can see this is your tibial collateral. This is your tibial collateral ligament, and this is your fibular collateral ligament. Then you can see we have two menisci. This is your medial menisci and this is your lateral menisci. Now movement occurs in the knee joint. We have the movement like flexion, extension, medial rotation and lateral rotation. So flexion, it is mainly accommodated by the hamstring muscles and also assisted by other muscles. So you have to just remember the name, hamstring muscles. Then extension, it is done by quadriceps femoris. Then we have the medial rotation, it is done by the popliteus muscles, and lateral rotation, it is accommodated by biceps femoris only. Next one, we have the ankle joint. Ankle joint, it is a type of synovial hinge joint, synovial hinge, and articular surface. We have the lower end of tibia, the lower end of fibula, and the talus. So articular surface, we have lower end of tibia, lower end of fibula, and talus. Then we have the subtalar joint. This joint, it is a type of synovial plane joint. Then articular surface, we have the talus and calcaneus, talus bone and the calcaneus bone. Then we have the talocalcaneonavicular joint. It is a synovial ball and socket type joint. Synovial ball and socket type joint. It is present between the talus, calcaneus, and navicular ligament, navicular bone, and this talocalcaneonavicular joint is accommodated or supported by the spring ligament. Next one, we have the movement of the foot. So movement like dorsiflexion, plantarflexion, that is occurring at the ankle joint. Then we have the eversion and inversion that occurs at the talocalcaneonavicular joint. So what is eversion? Eversion, it is the medial rotation of the foot, and inversion, it is the lateral rotation of the foot. You can see this one is your dorsiflexion. This is your dorsiflexion, and this is your plantarflexion. And at the subtalar joint, you can see your foot is rotating. Your feet is rotating laterally. It is your inversion, and your foot is rotating medially. It is eversion. So thank you for watching Anatomy.